Hey folks, Doug Blake with Body Design University. In this video today, we're going to talk about the pulling assessment that you're going to find in Chapter 12. Previous video that I just did last week was on the pushing assessment. This video is actually pretty short because guess what? For the most part, everything that is involved from the pushing assessment memorization component, i.e. overactive, underactive muscles, is exactly the same. Literally, table 12, and you may, if you're already in here, you already know it. Table 12.9, the solutions chart, and table 12.11, the solutions chart for the pushing and the pulling assessment, respectively, are essentially exactly the same. So from a testing perspective, knowing the underactive and overactive muscles that are related to either assessment are exactly the same. Keep in mind, just as with the pushing assessment, the pulling assessment is done standing up. And obviously, instead of pushing, now you're pulling and you're looking at the same three areas of the body, the lumbo-pelvic hip complex, or the LPHC, the shoulder girdle complex. So you're looking for the elevation of the shoulder. And then you're looking for the movement of the head in the sagittal plane, forward, jutting forward, as well. And so just like the push, you're going to notice that's, by the way, just do this. Come from here, go like this, and you're going to notice table 12.9, table 12.11, exactly the same. Now, it doesn't mean that the two assessments are the same. Remember, these assessments are designed to show you muscle imbalances, but these are the type of imbalances that you're probably not going, well, you may see them in your static postural assessments, but not necessarily. Quite often, these muscle imbalances, these very subtle muscle imbalances that you're not seeing during your static postural assessments, which will determine the pes planus, the upper cross or lower cross syndromes, if you don't see them there, these muscle imbalances, they could be much more subtle, and therefore these movement assessments is where you will see them manifest. And so in both cases, and of course today on the pulling assessment, the three joint or three kinetic kinetic checkpoints that you're looking at are going to be the LPHC, like I said, shoulder and head. And by the way, you're looking at it from the side. You're always, it's really simple, right? This one column viewpoint, it's lateral from the side. You're looking basically to see if the lower back is arched, right? LPHC. You're looking to see if the shoulder girdle or shoulder elevates, right? Just like with the pushing assessment. If you see this elevation like this, it tells you something about the muscle imbalances, and that's allowing and causing that improper movement to occur. And then, of course, you look at the head, just like on the pushing assessment. There's this issue of this jutting forward of the chin, and that's due to muscle imbalances in the cervical spine, basically, and then the muscles that sort of control the movement of the head, right? And that's going to be both the levator scapula and the sternocleidomastoid. Sternocleidomastoid, if you're not familiar, by the way, you can go into Appendix C and see it. But if you look at the side of your neck, the sternocleidomastoids turn the head one way and forward this way, and the other way forward this way slightly. So you can actually see those guys working as you turn your head. They contract, pull, and they actually pull the head forward slightly. So if those guys are overactive, they're going to pull the head forward. And then what we know is that the cervical, those what are known as the deep cervical flexors, are allowing that movement to occur, right? Overactive and underactive. These are the muscle imbalances that occur. Now, remember, you do this pulling movement, and all of a sudden you see this elevation of the shoulder girdle and the jutting of the head forward and this arching of the low back, and you go, whoa, what happened? The postural assessment was fine. Well, that's the whole point. That's why we do static assessments and then do the dynamic assessments. Very effective. But again, from a testing perspective, memorize one or the other. Okay, remember, in the lumbo-pelvic hip complex, if the lower back is arching, that means you have an anterior tilt of the pelvis. And what does that tell you? It tells you that the overactive muscles are probably, well, not probably, they are the hip flexors and the lumbar extensors. if you're struggling with trying to understand why it's those muscles, just go back a little bit earlier in the textbook to kind of understand why the movement patterns are what they are based on these muscle imbalances. So you should be able to do it. What are the overactive muscles? Hip flexors, lumbar extensors, right? Underactive muscles, meaning those muscles that are receiving a less than ideal or normal level of nerve stimulus, are going to be the gluteus maximus, the hamstrings, and of course the abdominals. Now, remember, when you're doing overactive, underactive memorization, you've got to know your kinesiology. You got to know your muscles. You got to know what their kinesiological function is. If you know the kinesiological function, i.e., flexion or extension, abduction, adduction, elevation, depression, if you know those for these main muscles that we're talking about here, then it becomes a piece of cake to understand which ones are overactive and underactive, because they're doing the exact opposite function. So you got the hip flexors versus the hip extensors. And what are the hip extensors? Well, those would be the gluteus maximus and the hamstring. So you could memorize it like that. But quite honestly, just memorizing these muscles, pretty straightforward. I would think pretty easy. Just write them down on a sheet of paper over and over and over. Shoulder, scapula, elevation. Yeah, for sure, you can probably see some protraction, but NASM doesn't care about it, so don't you worry about it. It's simple. Elevation of the scapula, right? Shrugging up. So if you're pulling and you're shrugging while you're pulling, that's indicative of muscles such as the levator scapula, which is, by the definition of the name, elevates, or levata, right? Elevates the scapular or pulls the shoulder girdle up. So those guys are overactive. And the upper trapezius, of course. See, the reason these dynamic movement assessments are more effective is because they're forcing the overactive and underactive muscles to really show themselves way more than you're going to see it in a static postural assessment. Does that make sense? In other words, in a static postural assessment, just as a for instance, you're not going to see somebody standing there like this. Okay, that doesn't happen. All you'll see is maybe a minor elevation, maybe a subtle positional change showing you the muscle imbalances. But as soon as you do these movement assessments, like the pushing and the pulling, oh man, they're really going to manifest, and you're really going to see these muscle imbalances show themselves. And so you'll see that the lower trapezius is the underactive. If the upper trapezius is overactive, lower trapezius is underactive, and they're giving you the visual cues: overactive, underactive in the head and neck. When the head juts forward, yeah, levator scapula, sternocleidomastoid mastoid are overactive, and you'll notice the levator scapula is also overactive in the scapular elevation. Why? Because they have most muscles have multiple functions, folks. So just keep that in mind. And of course, the underactive, therefore, would be the deep cervical flexors. Nothing difficult really in this part of the textbook when it comes to understanding. I will say this though, they will ask you a fair number of questions, overactive, underactive, on your dynamic assessments and your static postural assessments. So look, if you understood this, if it makes sense, how could it not? It's the same as the pushing assessment for the most part. But if it did make sense, please write the word understood in the comment section. Or if you do have any other comments or questions based on this video, please go ahead and put it in the comment section below. Look in the description box as well, because if you do want access to the entirety of the Body Design University NASM exam study prep material, that means all of the videos, chapter videos that go along with the textbook, as well as an audio text for each of the chapters, as well as quizzes, practice exams. We have an entire suite of study sets just on our Quizlet alone, and a ton of other resources as well. So if you do want access to that, just click on that link that you see in the description box below, and we can help you out with that as well. Remember, Wednesday nights, 6 p.m. Eastern Standard Time. Okay, so if you are Central, Mountain, or Pacific, you must adjust your times accordingly. So it's 6 to 6:30 p.m. every Wednesday night. We play Quizlet live. We use a special special Quizlet study set, create a little competitive environment. It's really, really helpful when it comes to learning and memorizing terms and concepts. So don't miss it. Again, have a great week. Let us know if you have any questions, and we'll see you next week. Bye.